Good evening, everyone. I am Dr. Shubhanshu, consultant diabetologist at Milo. I hope everyone is happy, healthy, and I wish you all the best. So, today's session is about one of the most important topics regarding diabetes and obesity. Well, diabetes and obesity are one runs in the family and they are equivalent to each other. I have given an important term for diabetes and obesity, and they are called as diabesity. Yes, diabesity is the combination of both diabetes and obesity. Before starting that, we should know that what is obesity levels. Excessive fat in our body, we have to calculate the body mass index. And when the body mass index, which is calculated by our weight and height, proceeds more than 30, then we consider that we are into the levels of obesity. From 18.5 to 24.9, we generally considered as normal BMI. And from 25 to 29.9, it is considered as overweight. So both overweight and obesity has different levels depending upon the body mass index. Now, how obesity generally causes the metabolic syndromes like diabetes, hypertension, and thyroid? Well, I would like to tell you that 70% of our metabolic disorders like lifestyle manifestations or lifestyle disorders like diabetes, thyroid, and hypertension, along with the dyslipidemia, which is the irregular cholesterol and triglyceride levels, are because of obesity and excessive fat in our body. If we say in a single line, obesity and overweight are the drivers of these metabolic syndromes. So the most important part is that if we remove the driver, we can easily reverse the condition. That is the most important part. We have a myth that if we are obese, we generally shift towards the medications, which is actually not the right way. We have to first find out the cause of our diabetes metabolic problems. Like diabetes is because of high excessive fat in our body. So what is the mechanism it does? Excessive fat in our body, what it does, it actually follow the plan of action. That is the most important part here. So what we have to do is that that excessive fat covers our pancreas and it ultimately inhibits the inside insulin to be released. As a result of that, there is a layer of fat around the pancreas which inhibits the inside insulin in our body to release, thereby not helping in controlling the sugars. As a result of that, there is a phenomena which is called as insulin resistance. One of the biggest factor for diabetes is insulin resistance, which is not the lack of insulin, but the insulin resistances like diet-related factors, obesity levels, stress factors. So all these factors are responsible for causing the metabolic syndrome. This is just a brief regarding how the diabetes and collaborates with obesity. So if we start decreasing our fat cells and start losing our weight, we can easily control a decreasing trends in our sugar levels. Right combination of the exercises, diet, and the portion sizes is the most important mantra in controlling obesity levels. We generally know that to control the weight, we generally go for physical activities, we go for a dietary regime, but sometimes irrespective of following each and everything, we are not able to see the decreasing trends and not able to see the desired results. This is just because of the barriers which is caused by the fat cells. Fat cells lives in our body for a very long period of time, as a result of which there are a lot of barriers in that. So there are other hidden factors in that, like menstrual irregularities in women, very, very common. Because of the menstrual irregularities, we may not able to see a decreasing trend in the weight, irrespective of you are following the diet and physical activity. Secondly, your gut health. Considering that all these things, 70% of our immunity is associated with our gut health and digestive system. And if our digestive system is not well, either in the form of IBS, irritable bowel syndrome, constipation, acidity, they have a tendency to cause fluctuations in the sugar levels. Also, they will hinder the fact that your fats are not burning easily. So this is considered as one of the barriers. So keeping a gut health is one of the most important part in considering the decreasing the weight. And the third is the sleep pattern and the stress. A good sleep of 6 to 8 hours is very, very important when you are following an important regime. So the regime of following the diet and physical activity is very good, but you have to manage these hidden factors to avoid that barrier. This is very important considering that we have to decrease the sugar levels also, and we have to decrease the weight also. As I have already said, the combination, the right exercises, the exercises in the form of, they depends upon individual to individual. 150 to 300 minutes per week will be the exercises in the form of brisk walking, or you can go for swimming or cycling. 10,000 steps per day will be more important in the starting point. But every individual has its own way of controlling the sugar levels, depending upon which. It's not like that. The person who has been following the diet and physical activity will give the same result to the another person who is also following the same diet, because it depends upon the different hidden factors which I have already updated. There are few questions. Basically, we generally should know that gestational diabetes is something which is diabetes which occurs at the time of pregnancy, that is called as gestational diabetes. So this is generally, we know that pregnancy itself is a hemodynamic process. A lot of hormonal surge occur during in the kind of pregnancy. The weight increases. As a result of this, the sugars also starts increasing. Okay, so this is generally at the time of pregnancy, we call as gestational diabetes. Then after the pregnancy, if the diabetes continues, then it is being converted into type 2 diabetes. It is not considered as gestation. Gestational diabetes is only at the time of pregnancy. Gestational diabetes, to control, we have to control it at the time of pregnancy, and it can be done with the help of particular diet. And if the sugar levels are high, we generally give insulins, because other medications in the cases of pregnancy are not recommended, or they are considered as teratogenic by most of the doctors for the safer side of the baby. During the first trimester, during the second trimester. So the safest medication during the time of pregnancy is basically insulin, to avoid that gestational diabetes. As I have already told, if it continues even after pregnancy, then it is not considered as gestational diabetes. It is type 2 diabetes. There are many questions regarding the apple cider vinegar. See, apple cider vinegar is considered as an antioxidant. They have an ingredient which is called as polyphenols, and they are responsible for not only improving the gut health, but they are also responsible in controlling the weight also. How they generally helps in controlling the weight? Generally, they helps in improvement of the beta cells in the glucose and the pancreas. This will ultimately help in improving the insulin sensitivity in the body, thereby avoiding the insulin resistances. This will improve the inside insulin, or we can say the fasting insulin, to release from our body, and thereby helps in controlling the sugars. So apple cider vinegar is very, very important. But there are few contraindications for apple cider vinegar also. Apple cider vinegar is generally avoided in the cases of kidney problems, because they have the tendency to decrease the potassium levels, and thereby they have the tendency to cause heaviness in the kidney. So generally, those who are having the kidney problems, they should avoid apple cider vinegar. It has a great response in not only improving the gut health, but also causing the lowering of the sugar levels, lowering of the blood pressure, and also helps in weight loss, which I have already told that they also helps in the dissolution of the fat. 15 to 20 ml, which is 1 or 2 spoons. Generally, we should see the impact of apple cider vinegar in round about 4 to 8 weeks or 12 weeks, which is because the consistency it has to be maintained is very, very important. Controlling of the blood sugar is very, very important. It has been said that if you decrease 5 to 10% of your weight, you can start seeing the decreasing trend of their sugar. And that is where you can control your sugar levels. Yoga and exercises have a very, very important indications in this. Yoga and exercises play a significant role. We have seen that they improves the insulin sensitivity. Every mechanism of lifestyle modification is associated with insulin sensitivity, thereby helping the release of the insulin, improving the insulin in sensitivity, and thereby helping to control the sugar levels. So yoga exercises have the similar kind of mechanism. As I have already told, it is the right combination of the exercises, the food, the nutritional food, and the portion sizes. Please remember that portion sizes are very, very important. Whether what your portion sizes you have to take is very important. The role of diet has been one of the significant factor in our sugar levels. We can say that food intake in diabetes is, we have to avoid this. We cannot eat the wheat content programs. We have to avoid the carbohydrates. Generally, I would like to tell you, in diabetes, whether in pregnancy or not, and nothing is being stopped. It is all about the portion sizes. The right combination of the diet should be there. There are people who are eating rice and controlling the postprandial meal levels in a very good manner. And there are people who are even eating rice and they are not able to control. So it depends upon your ability, how the portion size you take. Please remember, in diabetes, nothing is stopped. Everything is been in certain level or in certain portion where you can eat everything and control your sugar levels. Because if we start decreasing your diet, there are energy producing food. Carbohydrates contain 65% of our body intake. So we cannot cut down or completely rule out carbohydrates. It is very, very important to follow these things. There are few questions that if the husband is diabetic and what are the, generally diabetes is not a communicable problem. It is a lifestyle disorders. And I would like to tell you about the super 6 phenomena in diabetes. One is the family history, which you cannot avoid. There is a family history always. But what about the diet? There's a second point. There is a physical activity, which is very important. Okay, these three things are important. Then the fourth is your gut health, which I have already explained. If you want to avoid the barriers of losing the weight and improving the sugar levels, you have to improve your gut health, which can done by improving the proper diet and improving the proportion of the exercises, not an extensive exercises. As I have already told you, 150 to 300 minutes per week, depending upon person to person. That depends upon the exercises. The third is the mental health. The sleep cycle is the fifth and the sixth point. Your sleep cycle and mental health has to be the most important. If you are in pregnancy and you are in diabetes and you are pregnant, you can control the diabetes with the help of diet and physical activity, irrespective if you are feeding of the baby or not. There are few questions that I am diabetic and I have to feed my baby. For breastfeeding, there is no contraindication. You can feed your baby irrespective, demand feeding, and any time you want. The sugar levels are not contraindicated for your breastfeeding. So even if you have anything or diabetes, thyroid, hypertension, you cannot avoid breastfeeding. Breastfeeding is not contraindicated in any case. As already told, what are the foods in diabetes? We have to write about the portion sizes is very important. Generally, to control and to see the levels of your sugar levels, it is advisable to go for every 3 months HbA1c levels. HbA1c will give us an average glucose of the last 3 months, which is a gold standard investigations. And in weekly, once or twice, you can see your fasting levels, which is round about 10 to 12 hours from the last meal, and postprandial levels 2 hours after that. But there is also one important investigation, which is called as serum fructosamine. Like, see, every 3 months we have to wait for an HbA1c. We cannot see the progress in our body. And that's why there is an investigation, which is a very good investigation. It is serum fructosamine, which give us an average glucose of the last 3 weeks. So if you are not able to prick, there are some problems. We are not able to prick. We are not allowing ourselves to see the sugar level. So every 3 weeks or 4 weeks, you can go for a serum fructosamine and can see your glycemic control levels. Overall, if you see, to every 3 months, you have to go for an HbA1c levels, and every 3 weeks, you can go for a serum fructosamine levels. These are the basic points. We should just know that diabetes and obesity are one of the important problems in this, and they have been increasing because of the lifestyle sedentary facts, and there are so many stress factors going in our daily life. If we control and if we follow the formula of a super 6 phenomena, we can easily control the sugar levels irrespective whether we are on medications. And if you start decreasing your weight, burning your fat, your medications can also start titrating. There is no contraindications in breastfeeding. So sit back and relax and always consider that this is your regular regime, not follow any kind of stress factors that I have to decrease the sugar levels. Thank you so much. All the best.